wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to our program today. I want to discuss with you the whole issue of osteoporosis and osteopenia. Osteo relates to bones. Porous means porous bones. Osteopenia means weak bones or thinning bones. And we want to make sure that as we age, we keep our bones strong, because as we age, and if our bones aren't strong, you're well aware, older people can fall and they fracture their hips, fracture their wrists, fracture their shoulders, and fracture their lower backs as well. This is very common with people as they mature because they haven't kept their bones healthy. I have with me today Lesia Dubriel. She's our radiology technician. She handles not only our CT scan of the heart, but she also performs the bone density studies here on our guest. So why don't you tell us about the bone density studies, what it entails and what it does?
Good to be here with you today, Dr. Hotze. So the bone density scans, we use a Hotze scanner here at the Hotze Health and Wellness Center. The exam takes all of about 10 minutes. There is no prep involved. You'll be laying comfortably on a table with imaging done on your back and your hips, possibly an arm if there's some reason where we aren't able to do the back or the hip. Once we acquire the images, the computer, it's an algorithm that specifically lets us know what the bone density is looking like. It's either going to show us that it's normal bone density, if it's osteopenia, which means there's a little bit of bone mineral density loss starting to occur, just not enough yet to actually be considered osteoporosis. The results are available as soon as we're through scanning. With the information, your provider can help you decide from there what's the next step to take once I know what my status is.
Now, in conventional medicine, when people have osteoporosis, and by the way, this occurs in women about twice as frequently as in men. 1 in 2 women above the age of 70, maybe even 65, will have osteoporosis, and they'll have a risk in osteopenia. They'll have a significant risk of fracture if they were to fall. And as you get older, your balance isn't quite as good, and we see this. This is not at all uncommon to see folks that are maturing fall and fracture a bone. So we want to keep our bones strong. Now, there's some reasons that the bones get weak. One, it's the aging process. Second, it's the diet. When we eat if you have a diet high in sugar and high in sodas will just eat away at your bone. If you're drinking a lot of Coca-Colas, things like that, that will adversely affect your bone mineralization. Another thing is your hormonal decline. Your hormones, when you're young and vibrant, your hormone levels are good, your bones are nice and strong. Now, so in women, it's the estrogen and progesterone that keep their bones strong. In men, it's testosterone. But as we age, these hormone levels decline. Interestingly enough, when women take birth control pills, we find women even in their 30s that have osteopenia and osteoporosis, because birth control pills are counterfeit hormones and your body is suppressed, the ovaries are suppressed, they don't make your natural hormones. And the counterfeit hormones don't stimulate bone production or protect it, and they'll end up young women on birth control pills, been on them a period of time, a decade or more, will oftentimes have osteopenia. We see it all the time. The other thing, you got to be physically active. That's important to keep your bones strong. And a vitamin D is very, very important for bone health, as well as for immune system health and heart health. And mental health. Vitamin D is really not a vitamin, it's a hormone. It's made from, as the sun comes through your skin, UV light, it combines with cholesterol in your blood, and it makes vitamin D. And vitamin D is it's really a hormone in the blood. Cholesterol is a building block. It's the building block of our other hormones, our sex hormones and adrenal hormones, and also vitamin D. So really, in truth, it's really a hormone, vitamin D. And vitamin D is very important. Now, most people we see when they come in here they're in very low ranges. Right now, the range of vitamin D, according to a lab, is 30 to 100. This is being measured on people that stay inside. Most Americans don't spend their time outside. Most of them spend their time inside. So they get very little sunlight, so they don't make much vitamin D. Therefore, the ranges are all going to be measured in people that aren't getting sunlight, so the ranges tend to be low, from 30 to 100. They probably would be more realistically 200 years ago, people working outside, they might be 50 to 150 or 70 to 150. So we recommend taking minimally 10,000 international units of vitamin D with K2, and that helps balance out the calcium. But that's very important for bone health, is to have good levels of vitamin D. So don't hesitate to take and come and get your blood tested. I personally take 25,000 international units every day just to bump mine up to around 100 in it. And from all my reading, I've been told that you can get it easy to 120 or 150 and be in good health. And that might be really optimal levels. 250, you'd have to be over 250 before you'd have any problem with the kidneys. So don't hesitate to take vitamin D. Get your levels measured and get your levels up. It will help prevent against infections and bone loss, help prevent against heart disease and depression. It's very, very important hormone. The other things that you can do, of course, is exercise and make sure you eat a good, healthy, organic diet and cut out your carbs. So those are some things that can be done to ameliorate osteoporosis or osteopenia. Additionally, the sex hormones are very important. In males, testosterone stimulates the formation of bone. So as men age, our testosterone levels decline. We don't see as much osteoporosis and osteopenia as men because they make testosterone as they get older, and their bones tend to be stronger than women's bones, because when women lose their hormones at midlife and they begin to decline, really in their late 30s and early 40s, they begin to decline, there's bone loss. So we know that if we can replenish those hormones with natural bioidentical hormones, both in males with testosterone and in females with natural estrogen and natural progesterone, we have seen women who had osteopenia and osteoporosis have come back. We've checked them, and
that is true and correct.
We see that
can make a big difference.
Makes a big difference in bone health. So we want to encourage you to do that. I would encourage you to come in if you're, 40s, 50s. Come in and get a bone scan and make sure that you're doing things to prevent your developing bone loss, and that's by maintaining good hormonal balance, maintaining your hormones as you age, and taking plenty of vitamin D, exercising, and getting rid of all the junk food in your diet and all the Coca-Colas and all that. That's the Cokes and all the soft drinks. That's just going to suck calcium out of your bones. So you want to eliminate that. So do you have to be a guest here at the Hotze Health and Wellness Center to get a bone density? No, you don't, but you have to have an order from another doctor. But those of you that are our guests, we encourage you to make sure you've had a bone density and get that repeated. If you have osteopenia or osteoporosis, make sure you get on a program and then repeat it within a year or two to make sure we're moving in the right direction. You don't have to get it every year. Once we get you back on track and you stay on that program, you're going to do well. So I want to thank you for joining us today here on our program, and I thank Lisa for joining us.
Thank you.
You'll get to meet Lisa when you come in, whether you come in to do a bone density or come in to do a heart scan. She's the one that's going to take care of you, and she does an excellent job. Thank each one of you for joining us, and you can call us at the number here at the office and set up your schedule to get your bone density. I'm Dr. Hotze again saying thank you.
At Physicians Preference Pharmacy, we specialize in compounding bioidentical hormones, which means that all of our hormone medications are made right here on site in our compounding labs. The term bioidentical means that the hormones in the products that you're taking, whether that's in a capsule, a tablet, or a cream form, are chemically identical to those which your body produces. So your body responds the same way it would to its own hormones. This is important because hormones work in the body as a lock and key system. Just like your front door, only one shape of a key will fit the way it should to unlock that door. And the same goes for how hormones work within your body. For a medication to be the most effective, with the least number of side effects, we must give your body something that it recognizes as its own. And this is why we choose bioidentical.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.